talk about it like it's in a history book. Alright? Just like remember when we learned about that?
Alright, ready.
They need to be recognized.
This is Mr. Amadison, and he's here to celebrate Public Health Week and to describe to you the role of public health. We know that that's our goal, is to learn how does it impact our lives. So we'd like to welcome him, and we will show you our respect and enjoy the discussion. Yes.
Awesome. Alright everybody, thank you for your time. Like your teacher said, it's a privilege to be here. My name is Harry Madison. I'm a master's student at UCONN Health Center in the public health program. So it's one of the, of course I'm biased and I would say it's the best public health program in the state, but it's excellent. I'm working on my capstone thesis right now, so I don't have any more classes, just gotta write a long, fun paper and I'm done. And I work currently at Jefferson Radiology. I'm their healthcare administration fellow, so learning how to run and operate healthcare systems in hospitals. So that's what I'm currently doing now. And National Public Health Week, who's as excited as I am?
Woohoo! Yeah.
Oh, I can feel it. I can feel it. It's amazing. So,
That's a week.
last year, I also had the privilege of speaking in Miss Dombeck's class for the same thing, again, focusing on public health careers and occupations. And so, I think that these types of outreach are great because it's nice to have public health professionals in the classroom and actually discussing these things. So, I would love to ask you guys, what you guys think public health is and what you guys have been learning, but there's a lot of slides here, a lot of good information, so we'll get right into it, and we'll start. So you guys ready to think, ready to have fun? Yeah. It's kind of early, This is more fun than being in my office right now, so. Alright. Modesty. Awesome. So, when we think of public health, what's the first thing that comes to mind for you? Disease. Yes. And what about disease? Why don't you want to get a disease? What's so bad?
You get sick and weak
Because you're miserable.
You get sick and weak, miserable. Are you guys familiar with the term quality of life?
Yeah.
Alright, so your quality of life down. So, life expectancy is one of the big indicators that you use to see the health of a country. So if they say, you're United States, your life expectancy, if they said your life expectancy was 20 years old, would you say that that's good and healthy or not?
That's probably
That's-
good for like 1800s, maybe not.
Exactly. So, in 1900, what do you guys think the life expectancy
Like
was?
30, 40.
30s, 40s, so I get 30s, get 40s over here. You guys say 40s as well?
I'll say late 20s and early 30s.
See, you just messed it up for this whole side. You need to sit over here. Right. They're saying 30s. Life expectancy 1900, 48. 48 years old.
That would mean I wouldn't be around anymore.
Well, that's a surprise. 48 years old life expectancy. What do you think the expectancy is today?
Depends on the country. For our country,
80s?
80s, 90s. For our country.
For our country, the United States, life expectancy.
80, 90s.
I don't know.
What's the average? We always want to look at the average.
Women usually, men some do.
I would say no men live longer than women die from childbirth.
No.
Alright, you guys are close. You guys are close. It's right in the middle. It's at 78. So, we've gone from 1900s, 48, 2015, 78.
I'm gonna live longer.
30 years. What's up with that? Why do you guys think that's changed?
Maybe we should all talk one at a time.
Thank you, Buzz.
Excellent. So, 1900s. Make this quick. 1900s, 48. You're expected to live to age 48. 2015, your life expectancy is 78. That's a 30-year difference, right? So in 100 years, you're now living 30 years longer. Why?
We have better healthcare, we have better technology to help us.
Better healthcare, better technology. What about healthcare? Let's be specific.
We have more sanitation than back then.
Sanitation. That's perfect. Medication. Keep going. Vaccinations. Yes. What else? Think about safety. We were a little reckless in the 1900s, you know?
Public policy.
What type of policy? What type of laws?
Like speeding and stuff. We have
Speeding and stuff. What about speeding? What do you wear?
Seatbelts.
Exactly, seatbelts. What you guys listed are a number of public health innovations that have been enacted through policy and through research over the last 100 years that have literally changed the way that we live. We live 30 years longer. Our life expectancy has increased over 50%. And this is why we study public health. This is why public health is important. So we can go to the next slide. All right, so when we look at what is public health, in grad school, we learned this pretty much the first day. There are the 3 P's of public health. So we'll go through them quickly. The first one is prevent. What do you think public health is seeking to prevent?
Diseases spreading.
Diseases, all right? Spreading, injuries, things like that. What about protection? What are you protecting? So it says protecting populations
From getting it.
from getting it, all right?
Yeah.
Okay, so there's different ways that we can protect, so that's good. And then what about promotion? Why do you think promotion is important for public health?
Because we're aware of it.
People have to know about it in order to get the vaccination or whatever. If they
True.
don't know about it, they're not gonna get it.
All right, so that's vaccinations. What about other things? Think about things that you see on posters around your school.
Like
Prevent.
Washing hands. Think about when you're going to lunch. What do you see on posters? Eat healthier. I was gonna say, when I was in high school, they used to have like apples and like oranges, and everyone was still getting like the chips and stuff.
Eat at Chipotle and Dairy Queen every week.
They're telling you to eat a Chipotle
Yeah,
and
no,
Dairy Queen?
it's fundraisers for like the club.
There's like
So we're not gonna get into finance here on why you need to do some of those things. We'll keep it public health. So prevent, protect, promote, and then the end result is improving quality of life, living well. For public health, again, we're looking at the health of the public, and we'll get into this more actually in the next slide if you want to go over one more. Okay, there's not one in between this one? No? Go back. There's not one in between? All right, awesome. So, what is public health? So when we think of public health, any quick answers on what you guys think public health is before we really get into it? And what's your name? Francesca. Everyone, Francesca.
Isn't it more like community-based and it's not more like a universal aspect, it's just more like of the community and the place we're in? Such as is like public health in Manchester specifically, and then there
Okay.
could be related public health in Hartford, but it could be a little bit different.
All right, anybody else? Public health off the top of your head, without reading the slides. Of course you could read the slides and then sound really smart.
Honestly, basically public health is like their job is to make sure that everyone is staying healthy, everyone is like have every sanitary places so when people go certain
Yeah.
places they don't catch diseases or any types of influenzas and stuff like that. And he won't supposed to make it widespread.
Excellent. So the key that she said is everyone. The difference in private healthcare, a lot of times it's who can afford the care. So that's private. Public healthcare is everyone. So if you look at this chart right here, and everybody can see this all right? This is an excellent representation. I've used this several times on comparing public health to traditional medical care. And so public health, like Francesca said earlier, the community. So you're looking at the community as a whole. So public health, if I'm a public health professional in Manchester, my concern are the residents of Manchester as a whole. No matter what part of town you live in, no matter what school you go to, everyone's health is my concern. I want everyone to be healthy. If I'm a doctor and I have a medical practice, down on Center Street, and what is my concern? My patients, the individuals. Man, you guys are good. You guys are good. Public health. So we're looking at health status, health indicators. Remember when I said life expectancy, right? That's an indicator. Life expectancy is not a disease, it's not an infection. It is health statistics. So we're looking at the entire health versus when you go into the doctor, what do you normally go in with? The sickness, right? Versus, you know, how do you tell if a whole community is sick? And so there's different skill sets involved in that. Same thing, public health, we're looking to prevent disease and promote good health versus what's your status when you're going to the doctor most of the time?
They're ill.
You're already ill, right? And for public health, we're trying to say, all right, if there's some things that are preventable, we want to help you not get that. You know, if there's things that can decrease your chances of getting diabetes, we want to see less people actually go to the doctor and get the diabetes. We want to see the people not get it in the first place. So that is, again, another one of the main concepts for public health is that prevention and promotion. Diagnostics tools, we look at statistics, we look at epidemiology, we look at the way diseases progress statistically. You know, what is a doctor use to check if you're sick?
Your vital signs.
Stethoscope, he's got his blood pressure cuff, what's a sphygmomanometer? Sphygmomanometer? I always get that messed up. Horrible. I was an EMT in college too, I had to use it. I can't even say it. And back to finance, we were talking about why you have Chipotle and Dairy Queen fundraisers. It does a lot of times come down to the almighty dollar. In public health, every dollar you spend on preventing an illness, you actually, down the road, save $6 or $5.60 on healthcare spending. So if you spend $1 now to invest in, let's say, healthy eating in schools, down the road, you'll save almost $6, you know, per dollar that you spent on healthcare costs. Like I said, what's cheaper? Somebody getting diabetes and treating them for the rest of their life, or somebody never getting diabetes at all?
Never get it.
There you go, that's public health. Any questions on that at all? Alright, moving along. So, when we look at public health, you know, it's an interesting concept, and you guys seem to have a good grasp on what it is, and, you know, like you said, community, prevention, promotion, you guys understand these concepts, but who's actually out there making this stuff happen? You know, we all see, you know, you guys got Manchester Memorial Hospital there, you guys know that there's doctors and nurses and physician assistants and nursing assistants and things like that, but, you know, who's making public health work? You know, who's actually enacting those policies that make you wear your seatbelt, that make it illegal for you to purchase tobacco if you're under 18 years old? How do those things come into place? So, public health professionals are pretty multifaceted. So I remember when I was in high school, you know, my parents from Nigeria, and I don't know if you guys have any African friends at all, but
Yeah.
they're crazy, the
From
parents.
Ghana.
Yep, they're crazy. And they make you do school, and, you know, from like this side, you're gonna be a doctor, you're gonna be an engineer, and, you know, as much as you fight it, that's basically what happens. And so I wasn't aware that there were other things in healthcare outside of being a doctor, and so I always I love this slide because it really details all the different types of things that you can do to have a huge impact in healthcare without, you know, going through the clinical end. So you've got things like epidemiologists. Anybody know what an epidemiologist is?
It kind of is like the person that does statistics on like who, like, for the diseases or like how
Yeah.
who has it, who doesn't have it, how to not make it spread.
Exactly. So like we said, a doctor has their stethoscope, they've got their blood pressure cuff to assess your health status. Epidemiologists are one of the biggest parts of the assessment of people. You know, if you've ever heard of any statistics that you hear, let's say, you know, percent of this is pertinent. It may seem strange, but, you know, percent of students with, you know, STDs. You know, epidemiologists are the people that put that data together, present it to legislators and scientists and researchers, education professionals, so that they can enact things to help reduce the burden of disease and increase the living well-being. So other things, environmental health. You guys spoke to a sanitarian, correct? Anybody remember what a sanitarian does? This confused me when I first started grad school too, I didn't know.
They go to like different like places that you eat,
Yeah.
or just anywhere, and they say how the sanitarian clean places and
Yeah.
what they have to do to improve it.
And did anybody know what a sanitarian was before that person came in? Right? But we all eat out, right? We all, go get our hair cut, we all get our, nails done and stuff like that. Even guys, as you get older, gotta keep it fresh, all right? So it's amazing that almost behind the scenes, our safety is looked after by some of these individuals. You've got policymakers, they're responsible for writing the policy. You guys familiar with, I don't know, if you guys take like a government, what grade are you guys in? 10th grade, 11th grade, junior, senior. All right, so if you're familiar with how the legislature works, what you do is you have people in public health bring forward, let's say, issues. Back a few years ago, there was issues with a chemical substance called BPA, and it was found in children's toys, and it was found in, I don't know if you guys are too young, with baby formula, the tin on the inside is lined with something called BPA. And without getting into too much detail, they found it to be an endocrine disruptor, which can cause cancer later in life. And public health policymakers had to do research and put forth and go in front of legislative committees and lobby, in a sense, without like the kind of negative money-making connotation, lobby to push a bill to ban BPA. And so they actually did push that bill through, which is amazing because you wouldn't think, you go and get your formula, you're not thinking, what in here could possibly harm me. When you go to the grocery store, you're not thinking, what could possibly be in this food that can hurt me. Not everybody is a scientist or a lawmaker and can analyze it. And so it's nice that there are professionals that are out there, like nutritionists looking at what goes into your food. And again, so there's a lot of different careers, and we can talk about this for days, but anybody interested in a career so far? Maybe I can focus a little on that there. What about yourself?
I said I want you to go into radiology or cardiology for that, so I'm not sure yet.
Radiology and cardiology, nice. Radiology, that's what I mean. What about yourself?
OBGYN.
OBGYN, okay, excellent. You have one?
No, same.
Same, OBGYN.
Cardiothoracic surgeon.
Cardiothoracic surgeon, all right. I just did a project on that. Anybody else? Neonatal surgeon. That's what my brother wants to do. He's at Tufts Med School right now.
Paramedic, firefighter.
Firefighter?
There's some
Firefighter?
paramedic.
Yeah.
Oh, no, forensic anthropologist, that's right.
Forensic anthropologist.
Yeah.
Alrighty. We're getting crazy here.
What is that again?
Two other ones? Orthopedic surgeon, somebody said? Pediatric surgeon? Alright. So these all the occupations you listed are great, and like I said, even as a physician or nurse, you're still part of the public health spectrum. So there's a lot of different careers. If we keep going, I think there's a few. All right. So here, this is a guide. I know you guys are pretty tech savvy. There's a lot of resources out there that you guys can use, and I always say, even my youngest brother. He's a senior in high school right now. He's going to school next year, and I've been telling him for probably 3 years so far, I'm like, Dexter, there's a lot of types of occupations and things out there. You need to start looking at what really draws your interest. Like, there are a lot of things that you're interested in, like that seem cool. Like, yeah, I'd love to be, biomechanical engineer like my sister, but in practice, do I really want to go through all those math classes and do fluid dynamics? And probably not. So it's good to actually research not only, cool, this is the name of the job, this is where I get to work, and this is how much I make, but what the components of the job are, what are the future projections of that career. You guys familiar with a job market? Mm-hmm. Familiar with what a job market is? Okay, so you want to look at the job market. Fortunately for public health, as healthcare in the private sector, spending is increasing, and they're looking to cut costs in there. They're understanding the importance of public health more and more, and so you'll see a lot of different types of positions opening up for public health across the board, especially in New England. You know, Connecticut, Massachusetts are some of the states that are really in the forefront of public health. So we live in a pretty good area. So you know, Health Careers in TT, the hot guide, again, it's good to start looking at these things. You may think, I'm too young, I gotta worry about college, all this stuff. I'm telling you, the earlier you look at these things, the better. Okay, so the next one. Alright, so let's see if some of these videos could work, right? Kids like videos? Kids like videos. You guys don't like being called kids though? No?
Or young adults.
Young adults.
I'm not gonna try to make like any like funny jokes, because I did that last year, and I mentioned this band called 98 Degrees, and nobody knew who they were. I know, yeah, she just laughed at me. She, you know?
Yeah.
Well, yeah, the teacher knew.
Teacher does.
That'd make me feel better. All right, this is public health. Yeah.
Oh, yeah. Thank you. Thank you, Modesty.
You seen the video before?
I can't hear them. Can't see what you.
Am I turning up the light?
Doing things everywhere.
So when people walk by, they'd be like, oh, this is public health. Everything around you is public health. The stickers will be like our voices constantly reminding people that this is public health, this is public health, this is public health.
And by seeing these stickers, they'll see that we do a lot, and they'll see that they actually need public health to keep them healthy and to keep them well.
Hybrid buses in New York provide cleaner air for everybody.
Thank you. If there's a bike rack, that means that more people are actually going to be riding their bikes instead of taking cars or taxis.
Let's definitely stick to that. Having a fresh fruit stand like this encourages people to include fruits and vegetables as a part of their daily diet.
We're sticking it so people can see that this huge cigarette isn't good for them. The message is clear. Water safety is a public health issue because if we don't protect our drinking water, then it can trickle down into the food that we serve.
It really helps people to pay a lot more attention to their nutrition and to the things they're putting in their body. It's public health right there.
Community health bans are a public health intervention at a community level, making sure that the aging population not only has access to certain services, but has transportation to get there.
My definition of public health relates to the environment.
Public safety.
Eating well,
Free clinics.
sewers,
Washing your hands.
It's teaching safe sex.
For AIDS awareness.
No smoking because of public issue, yes.
maybe air quality, truth in labeling.
I think it has to do with your eating habits.
Educating the public about ways to improve their health and happiness.
Helping people with cancer.
Being on constant monitor of your own body.
Taking care of the citizens of our city.
Public health is about controlling the factors that you can't control that control your health. You're only as healthy as the world around you. Public health is your health.
All right. So you guys were on to a number of the issues that they touched upon earlier. Anything that they missed that you think, what do you think public health is? Did that give you some insight a little bit into what that is? And one of the ones that always surprised me, like transportation, you know, public transportation system, you don't think of that as something that's public health, but when you think about the environment and decreasing CO2 emissions and improving the structure of actual towns, when you look at the the urban and regional planning that goes into building towns around cars, a car-centric town or a person-centric town, which do you think is going to be healthier? And public transportation actually aids to that. So, any questions on that video? All right, and I know we've got about 10 minutes left. So maybe we'll watch one more video, and then there's one more slide, and then I'll take some questions. The next video won't work. Go to the next one more. Next slide, yeah. One more. One more.
We can always watch these after.
Yeah, exactly. Yeah, this one's good.
Oh, e-cigarettes. Do you remember the article I gave you guys?
Yes.
So that was the alternative assignment. Yeah. About
So,
e-cigarettes.
what do you guys know about e-cigarettes already?
It's terrible.
They have
It's terrible.
It's terrible.
Oh my gosh.
It has the same thing.
Yeah.
But
Less nicotine.
like the more that people smoke it, it like basically
Pause it,
it
yeah.
basically equals like a regular cigarette.
She's never volunteering for this again.
No, because I had to copy and paste the link so that it works.
Oh, you doing your homework on the other side?
Yeah.
Alright,
Thank
so,
you, Max.
what were you saying? You can continue. She's giving me a look right now.
You forgot.
E-cigarettes. What do you guys know about e-cigarettes? They're rising more. Anything else? Alright, maybe watch the video and you know a little bit more? Probably. Alright. Play on.
I love that.
These are real ones, like with nicotine. That was corny.
Healthcare policy right there.
10%. Was the Florida man okay?
Yeah, I mean, he's not that. His face is just like, plastic surgery is pretty good nowadays. Alright, so, anytime I watch videos like this, interesting thing, right? So advertising, right? When they saw like the chocolate and the Reese's peanut butter, everybody's like, oh yeah, oh. You know, the smoke tornado thing, well, like, oh, I heard people, you know, I heard it. Alright? So, that's how advertising works. So, e-cigarettes are an interesting thing because, you know, are these cigarettes in disguise? Who manufactures them? We don't know a lot of information about them, on the chemicals and how they impact you. So, it's important for public health to be involved in these types of things because, similarly, back in the day with tobacco, the tobacco companies had a lot of political ties and a lot of financial dealings on Wall Street, so they were able to, you guys know leverage, leveraging. So they were able to leverage themselves into extreme power positions and advertise, even at one point to use. I don't know if you saw in 1971, they stopped advertising, and they actually were advertising to children as well. They had a guy, Joe Campbell, and he was a cartoon, and he looked, you know, super cool. He got his leather jacket on, he's got his aviators, and he'd be smoking. He was just having an awesome time. And so, it may not always be apparent when public health is important, but again, it's important to be vigilant. So, back to my other question, what do you guys know about e-cigarettes? From your readings, do you think this is important to public health? Why do you think it's important to public health? It promotes
E-cigarettes are bad.
e-cigarettes are bad, so then what does public health need to do?
We need to find a better substitute because e-cigarettes are like advertised to be a better substitute for actual cigarettes, but they still have like the amount of bad chemicals in the regular cigarettes. So public health should do is really find a better alternative or just shut it down and make it general.
Exactly, and the way they do that is through research and informing the public, correct? Right? We have to promote, so when we promote good health, what would be a public health stand? If you were to have like a public health slogan about e-cigarettes, what would it be? You had one. What did you got? Don't smoke. Did you put a hashtag? Hashtag don't smoke? That's it?
No smoking, a regular trying to
Yeah, hashtag you
Or no
smoke.
tornado?
Yeah.
Right.
Hashtag no tornado, right, from the little trick. Alright, so there's one, you go, one slide, one more.
What?
One more.
Isn't that pregnant guy?
Yeah, through the videos. No? We missed a slide. Okay. Slide is, did she send you the same one that we had in the email?
It's the one from the email that I saw.
Yeah.
So I'm not sure. It's different.
Yeah, it's missing, maybe it's, go back more. Before the video that, yeah, keep going. One more. Alright, well, yeah, I guess the slide's not in there. So, I guess we'll go really into questions. I know you guys have a few more minutes, but I do want to make sure that I take time to answer the questions because I think that that's important. So, what do you guys feel? Hopefully you guys got some insight into public health. I don't know if you guys have any questions at all for me. I know you have this survey.
They have a survey.
Yes.
They can also ask you questions about your journey getting there.
Yeah,
that would be
of
great
course.
too.
Yeah.
What school did you go to for college?
I went to Cornell for undergrad. Yeah, so I was studied biology and business management. Was my minor.
Does your zip code influence your health even more than your genetic code?
Does what?
Does your zip code influence your health even more than your genetic code?
Well, I mean, I studied public health, so I know the answer to that. But what do you think?
No.
You think no?
Yes.
I think so.
Yeah, I definitely think so. You know, you gotta watch the level of information, But if you look at
Well, if you live in a bad neighborhood and you're gonna get shot, that's obviously gonna be more.
well, not necessarily that, but if you look at
Like pollution and stuff like that. Like,
if you look at where Whole Foods are located, for instance.
oh
You
yeah.
guys know about Whole Foods? Is there Whole Foods in the north end of Harvard?
It takes to.
There's not. No. Any other
I got a question.
questions? Yes.
So what made you say that you really want to be public health and if you didn't want to be a public health person, what did you want to do?
Yeah, I went to school to become a doctor. Like I said, I wanted to go into orthopedic surgery. And then what I realized is that as a physician, there's a lot of knowledge and a lot of power that you have, but you're only able to make an impact on a small group of people. And I would have to wait a long time to do public health. I was able to get right into the field before I do what I did now. I worked in corporate wellness, so going to companies and putting programs in place to help promote the health of employees. So, putting in walking programs and healthy food in the cafeterias at offices. Corporate Fitness and Health, a subsidiary of a diversified group. So, yeah.
So, do you think it's something really that you're going to do for the rest of your life, or is it going to expand it?
For what I want to do, for what I want to do, I want to manage and run, ideally, a community health center. So that's what I'm in a fellowship program now to learn how to be a healthcare administrator. So, and they look at the clinical operations, business operations, financial fitness, things like that. Population outcomes.
I'm sorry.
Yeah.
Okay. How long did you go to school for?
Undergrad is classic 4 years, and then I've been doing my master's. Full time it takes 2 years, part time is 4 years.
You guys, can you take it up with a big round of applause?
Thank you.